All right. Are we, is it noon on your, or is it 1 on your side? Sorry, I'm in Mountain Time Zone today. So Dr. Coleman, Dr. Nielsen, are we ready to rock and roll?
I think we're ready.
We are.
Awesome. All right. Well, let's go ahead and get started. I'm sure others will probably be joining us after we get started. I know every day is a little bit busy these days. So as always, we appreciate people being with us to discuss how we are going to keep kids safe and keep kids in school. And that's what these meetings are all about. Today, we are going to hear about the metrics from Dr. Nielsen, and then we're also going to hear from Dr. Watson about from the view from the schools. And then we'll have some discussion, and really we are also hoping to hear from all of our members of our work group what you guys are hearing out in your communities, and you know, what kinds of questions are people asking you, what kind of issues are you facing, because odds are good that a lot of other school districts are also facing those same problems. So we would like to have a really great discussion about that today as well. So again, welcome. Thank you so much for being with us today. Dr. Coleman, anything else that you can think of?
No, I just, again, appreciate everybody being here and appreciate your time. And if there's, any hot topics or questions that you guys have, I think we're going to feature the member section. I think Marcy emailed today, so be looking for that and let us know ahead of time so we can add you guys to the agenda. We appreciate that.
All right, awesome. Well, with that, Marcy, I think we'll turn that over to you to go through metrics for us. Thank you.
Terrific. Thank you. And I will try to get through these quickly. I realize these metrics are things we are showing you every week. And so there's not always going to be a lot of change, but we do feel like it's really important for us to have a solid baseline from which we're able to track what's happening in the state. So Dominique, if you would hit the next slide, please. So you can see here that things are finally starting to calm down. Daily cases below 900 for the first time since July. Deaths are also down 50%. So I think people are starting to breathe a bit of a sigh of relief. Often when we see the concern about COVID in past waves, when that happens, we see testing go down, and you're seeing that reflected here in the yellow. And vaccinations have also sort of flattened, as you can see here based on the graph in red. They are just starting to tick up, which we see as a good sign. And in part, that is due to the boosters that have now become available. We anticipate this increase to continue, especially as we get closer to approving vaccinations for kids. So next slide, please. We continue to trail the national rate for vaccination for youth. We are every week we hover between 7 and 8%, being behind the national average, and so that is something we will continue to focus on in this work group, and we'll have more to say about that in the next hour. Next slide. We continue to point to these 3 very key measures in helping us keep schools safely open. And again, want to mention that there are other things that we are doing in the public health community to keep kids safe around ventilation, certainly treatment once a kid unfortunately winds up in the hospital. But the 3 major tools are vaccination, testing, and masking. And we will continue to try to provide you with links to important research as it is developed, so that we can track what's happening at a national and international level. We've got some good statistics to share with you today about Kansas. Next slide, please. So the rate of application for funding and ongoing testing, we are so grateful that the word is getting out across Kansas school districts, and we're seeing more and more schools sign up because they're interested in the testing program that KDHE founded. So you'll see here an additional 7 districts submitted budgets. We've got responses from 2 more districts that are interested. And so the number of school districts that aren't engaging continues to shrink week after week. And I think that very, very well could be likely to the conversations that we've been having as part of this work group. So I want to echo Jen and Stephanie's thanks to all of you for participating in this dialogue. So next slide, please. Here we're looking at the school districts reporting on the testing metrics. This too, we are appreciating that school districts are trying to get this information to us so that we can track this closely. You can see here PCR antigen tests. We are looking at an increase in the positives, but of course we are doing more testing. And here we've got nearly all school districts reporting that the tests that they're doing when they're doing this kind of testing are antigen tests. And if folks want to talk about that more, we can certainly do that as well. So next slide, please. So the mask mandates by the school district and the number of kids in Kansas that impacts. We are carefully tracking mask policies, of course, and you can see here, we've got masks that are encouraged but not required in about 47% of our school districts. But in terms of population numbers, we've got about 56% of kids in Kansas who are in a school district that requires a mask for all students. And so we continue to make progress. We know school districts continue to have these conversations, as do superintendents. And we know that sometimes school districts are adding masking policies as they see how the pandemic is unfolding in their community. Next slide, please. So we constantly look to this slide, recognizing that this is sort of an observational study. This is not a randomized study, but it is important for us to understand whether masks at the end of the day prevent outbreaks in schools. And you can see here that these trends continue to show that in Kansas, when we require masks, we see fewer outbreaks impacting fewer students. And you can see that reflected in the data this week, as we saw last week. That continues to be good news. Of course, we are shrinking that number of school districts who haven't responded, and so this data becomes richer and richer and more rigorous every week. So thank you to all those school districts and superintendents and school nurses who are bringing this data to the state. Next slide. I promise I'm almost done. We got to see the fantastic new graphs that we have from KDHE that allow us to look at kids within school districts and see what the youth vaccination rates are. We've got them by county as well as by school districts at KDHE. So we know school districts are using this information and tracking it carefully. Next slide, please. And so just a few things to emphasize around vaccination as we get ready for the FDA to ultimately give emergency use authorization for vaccines for kids. And that is one thing that we have done really well in Kansas, and you all are a testament to this, is we've tried to engage providers as partners. I've had other states reach out to me to talk to me about how do you have so many primary care providers engaged in this conversation. We are certainly not perfect. We continue to want to recruit providers, and that's not just in physician offices, also in retail pharmacies, et cetera. But we've been able to increase the number of providers over the last 18 months that are giving vaccinations from 300 to over 2,000. And that's very impressive. As I mentioned, and I hope we can talk a little bit more today, we need more providers. And we have some communities where we see pediatric and family practice offices really nudging their hospitals to try to get in the game. Would love for us to be able to talk about the importance of hospitals also being vaccinating sites. So next slide, and I think I'm all done. Just a quick flash of a slide to let you know the kinds of things that KDHE and the state is doing in order to make getting vaccinations as easy as possible. So the 26 mobile vaccine clinics, a MassVac site that's going back up in Shawnee Museum. And as we get ready for the EUA for kids vaccinations, we have sent out a survey to all of the public and private schools to try to understand if those schools are interested in having mass vaccination events. We certainly want to be able to support that. So I'm going to stop here and hand it back over to Jen and Stephanie.
All right. Thank you so much, Marcy. Much appreciated. I guess I might stop for just a second and see if any of our members have any questions or comments about the metrics that were presented just now. All right, and we will definitely have time to discuss this more. We have a discussion, as you can see, in the agenda as well. So, so please, again, you'll hear us encouraging the work group members to please bring any thoughts or issues that you're addressing at this time to the discussion, because that's the beauty of our work group, is that we were very intentional about getting people from different parts of the state, rural and urban, different specialties, within education and healthcare. So we do want to hear your voices and what each person is kind of talking about in your neck of the woods in Kansas. So with that, we'll go to Dr. Watson.
Thank you, Dr. McKinney. It's good to see all of you. So what I always say in any of our business, when you don't hear a great deal from one week to the other, that's good news, right? Which means that we're settling into a routine that I think is productive. And I'll give you some examples that Marcy walked everyone through. We have a greater number of responses around wearing masks, so that data can start to be analyzed, I think, at a much greater accuracy. That's good news. We continue, when you look at the number of schools from already have the grant on testing to those interested, it's well into the upper 70% and over 80% of students. What that tells us is, and we've said this before, testing works, and it works from a variety of ways. This is voluntary testing in order to stay in school or to stay participating in an activity. It's done in various ways. But what we have found in schools is that of the three mitigation criteria that we look at, vaccinations, testing, and masking, voluntary testing has met with less resistance than the other two. I don't know if you see that in your practice, but I'm not saying there's not without some resistance, but we have less resistance to voluntary testing because people want to be in school and they want to participate in those activities. Next week, we will meet face-to-face with superintendents. We have a Zoom conference with them tomorrow. I may get more data, but as you know, since March of 2020, anytime you have a week where it's calm, that's good news. And that's what I've been getting on the school side this week, It's not been the mass numbers of phone calls saying X is happening. What is the plan? What can we do? It's more longer term mitigation that people are thinking about, which is a good sign. Hope we can hold that. I'm not guaranteeing that we can. As you all know, last winter was a brutal winter, and we're hoping that that doesn't occur again. So, Dr. McKinney, that's the update for this week.
Thank you so much, Dr. Watson. We appreciate it. And you're right. A lot of times, no news is good news, especially during a pandemic. So thank you. Let's see. Again, any comments? I just want to pause and make sure that we allow time if people have any comments. I know there's a comment in the chat regarding Marcy's information that she shared. There was a comment about the slide showing school mask policies and how they seem to be related to numbers of school outbreaks. Do we have similar data on the percent of 12 to 17-year-olds who are vaccinated and the number of middle and high school outbreaks? Is that something we have?
That is a great question. And I know that Farah is fully expecting me to kick this over to her, which is exactly what I'm going to do. Although Dr. Duvey is here as well. I don't know, Joan or Farah, if you've got some insight into that.
We have not done that analysis. So we would have obviously the information on vaccination rates within a school district boundary. And we would have a list of schools, public and private, in a school district boundary. So I would think it could be done. We haven't done it yet.
I agree. I think it would have to be within that boundary. I think it would be hard to look at individual schools unless people are willing to self-report that data.
Well, we know when an outbreak is identified in a school. So it would be just a matter of plotting the schools with known outbreaks and then looking at the school district boundary, right?
Right, it'd be boundary, yeah.
Yeah, and this is Alan Greiner. I know this stuff is kind of associational, but and Farah, you're the expert on this, not any of us docs, but you know, the bigger aggregated area might give us a sense of what the trend is there, just like I think what we're seeing with those mask associations with outbreaks. And I think it'll be even more interesting once we get the EUA for the younger kids and can start to see that data come in and maybe see what happens as we get further into the fall. But I'd be curious to see that.
Yeah, it's an interesting question.
Great. Thank you so much. Sorry, Dr. Ahmed, I feel like we always give you homework whenever we have these meetings. But thank you for humoring us. All right, so we actually we do have some topics for facilitated discussion. Dr. Coleman, do you want to kick us off, or would you like me to on some of the topics that we're going to address today?
I'll let you start if you don't mind, Jen. I appreciate
Yeah,
it.
absolutely. All righty. One of the things, there are a few things that have kind of come up that were hot topics, and I would love for us to have some discussion on this. One of the things that I know weighs heavy on people is the mental and psychosocial impact of COVID-19 on kids. And so there was an AAP publication that addressed the impact on children. And then there was an MMWR article as well talking about impacts to adults and young adults being the most severely impacted, although it doesn't specifically talk about, like kids, but we do have the young adults in there. So what are you guys seeing around the state in your school districts or in our exam rooms that might relate to the mental and psychosocial impact? Are you seeing a difference with, for example, the test to stay programs of keeping kids in the schools, comparing maybe now to last year? Any insights that you might have?
Hi, this is Kimber Hazitz in Wichita, and we are seeing a lot of social, emotional, mental health effects of COVID in our communities, and seeing a lot more behaviors with students, more suicidal ideations. Conversely, we're also seeing the stress level of staff members too. With that, a lot of anxiety and stress, and trying to get them referred to employee assistant programs, mindfulness, things like that. So I think when we're looking at those social, emotional, and mental health needs, we need to think about not just our students, but also our staff members that have been through quite a bit the last 2 years. I do think it's so valuable to be able to have kids in the school and able to do the test to stay. So that they're not isolated at home unless they have to be. Of course, if they test positive for COVID, we've got to isolate at home. But if we're a close contact and we have this mitigating measure of wearing masks and trying to get vaccinations increased, but also this testing piece has been huge to see the numbers of kids that are able to be in school learning, but also being able to get those peer relationships back in check that they missed out on so much over the last couple of years.
Wonderful. Thank you, Kimber. Appreciate it. Anybody else?
So important, Kimber.
Oops, sorry, I think we might have lost somebody there talking.
Yeah, that's Dr. Mills. I'm just going to give you a view from the streets, so to speak, in Leavenworth. What we're seeing is an exacerbation of an already pre-existing problem of having little resources for children and young adults for mental health. This is just simply compounded an existing problem we've been talking about for 10 or 15 years. Since the, I'd say, early 2000s, with the loss of all the child psychiatrists that were in the community, and pretty much everybody just in large groups now, it made it a whole lot worse. We just don't have the manpower or woman power to have kids seen. I mean, there's an existing level of uncomfortableness and, to some degree, just downright anger that you see that's simmering underneath the surface because people feel like they've been shorted. The kids have lost their education. The families have lost some of their freedom to be able to do things that they normally would do to mitigate some of the stress, like take vacations and take the kids to grandma's house for the weekend and all that stuff. And so you're getting a lot of compounded stuff that you don't really kind of see, that people don't talk about, but it's just kind of there and it's simmering. And that's one thing I can tell you is kids pick up everything. You don't have to say anything. They pick it all up. So, and so that sometimes is reflected in shorter fuses for them in school, less tolerance. I think maybe a little bit more bullying that goes on, or being allowed to be being bullied. That's certainly in the last month, we've seen a big uptick in that amongst males, in particular. So I think the testing thing, I think, is certainly going to be helpful to keep kids in school. But this is already just simply making a situation that was pre-existing a lot worse. And so one of the takeaways from this is that we need to kind of look at trying to up rank to do more to get these services available on an ongoing basis, and not just for this crisis, because this isn't going to go away anytime soon. It's a hole that just got deeper. That's about all. So that's my view from what I see in my practice, is we're having a hard time getting people referred places. There's a wait for beds. It's getting near, and if this continues, it will be a crisis, especially in ERs. They get these kids that are angry and that don't have any place to go. Either that, or they're going to end up in the legal system, and that's even worse. So, all right. So,
Thank you so much, Dr. Mills. I think the view from the street is exactly what we're looking for, because I mean you're dealing with it every day, And I think that is so important to acknowledge that, and the challenges we were already having that have just gotten worse throughout the pandemic. So thank you.
Dr. Mills, I appreciate those comments. And I would even add on that I think we already are in a crisis, at least kind of what we're seeing in the hospital settings. We already are getting these kids that are in the hospital with multiple suicide attempts and are holding in our hospital settings because we can't get these kids placed. I know this summer the University of Colorado declared a mental health crisis, and our team in Wichita at KU had kind of added on to that we are seeing that sort of similar crisis in our state as well. So.
Anyone else? Any other comments on mental health, psychosocial impact?
Jen, I wonder if it wouldn't be helpful when we come back together next week for me to bring some resources, some of the things, excuse me, that we're trying to do in order to get services to youth. There really is a dearth of healthcare providers for mental health providers for all kinds of different reasons. But I will bring some resources back next week so we can at least empower folks on the phone or folks participating online to have information. I know it's always very, very important when you are talking about suicide to be certain to provide resources to suicide hotlines, et cetera.
Thank you. That would be awesome, Marcy. If I might take a moment to kind of share, I guess maybe a personal comment that I do truly believe that that the Test to Stay program is good. I think it's great. I think it's wonderful to have kids in school. I've heard comments about that mental health is being impacted by masks and being impacted by testing. And I guess I just kind of want to make this statement that I don't believe that to be the case. I believe that masks are helping kids stay in school and have that social interaction. I believe that testing is helping kids to stay in school and have that interaction that they need with their peers. So I hope that's okay to say. If anyone has other comments about that, and I do see a hand raised, but I just don't. I don't want us to. I want us to recognize that the data is showing us that, that mask and testing are great tools in the mental health of our students to keep them where they need to be for their education. So, all right. And I see Kevin with his hand raised.
Yeah, I just want to kind of chime in on the adult mental health issue. For our members, we're really encouraging folks to take advantage of their employee assistance program that many school districts have. And then we also received a grant from NEA that provides an employee assistance program for any of our members that do not have access through their employer. And that's going to last through, I think, February. And we're really encouraging school districts that don't have an employee assistance program to enroll in one. And so we're going to be pushing that message out here. We did that last spring, and we're going to try to do it again. The reports that we're receiving from teachers and other school staff is there's a pretty long waiting list on some of those larger school districts that have employee assistance programs. So we're trying to problem solve that. And if there's any of you folks that understand how we can kind of cut through some of that red tape, let us know.
Marcy, do you have that answer? Don't you cut through all the red tape?
It is my goal to cut through the red tape. Yeah, I'm more than happy, Kevin, to chat with you offline and I think to connect you to the right folks in the governor's office. This is a priority of hers and has long been a priority. So happy to work with you.
Awesome, thank you.
That's awesome. Marcy, I was just seeing if that would work, and apparently, thank you. Great. All right. Any other comments there? We do have a few other topics, but please, like, I think this is such an important topic. When we talk about health for kids, we also are talking about mental health for kids and for the teachers and staff. So I think it's such an important topic. All right. Oh, Dr. Watson.
Thank you, Dr. McKinney. I think we could all speculate why anxiety, depression, and possible youth suicide. I say that because we don't get that data till very much in arrears to officially know. But I can tell you that with the federal money that's been given to schools for COVID relief, that's called in our acronym world, the ESSER money on the public school side and the EANS money on the private school side, a large amount of money, millions of dollars are being spent by local school districts for mental health of both staff and students primarily, but also for staff. So I know that there are a lot of people trying to respond to what is certainly seen as more anxiety, more depression, and possibly an increase in youth suicide. So I just wanted you to be aware of that. That money is being used not only for learning loss, which is the #1 reason it's being used, but very closely behind that is social, emotional, and mental health supports.
That's awesome. Thank you so much, Dr. Watson. Really just hearing you all from the education side of things, just already being proactive with all of this is so inspiring. So thank you so much. All right. Any other thoughts on that before we move on to the next? I think one of the other topics we were hoping to talk about was how to reach rural or otherwise underserved children. So like, how can we ensure that all kids have access to information on and administration of the vaccine? And as Marcy was presenting the data about youth vaccinations, I look at you, I think we automatically, our eyes go to our own county, right? When we're looking at these maps and our own school districts, and I see mine, not the color of blue that I would like it to be, so how do we do that, and what are we doing? I guess what are we doing and what's working would be great to hear. And what should we be doing? Because really we're not where we should be, right? So how are we going to get more of those 12 to 17-year-olds vaccinated? Any thoughts there? Oh, and then we have another comment on mental health that we'll get right back to.
So I don't mean to put Dr. Brule on the spot, but I'm going to put Dr. Brule on the spot because she is in a rural county, and what we see when we look at the statistics, to the point you're making, Jen, is we've got the top 20 counties in terms of low vaccination rates, essentially all being rural counties. And so the challenges there are pretty immense because in the state of Kansas, we have a decentralized public health system. We really rely on local public health, but local public health, not unlike teachers, are tapped out. So then we pull in providers. What does it look like on the ground in a place like Rooks County?
It looks just as diverse as the rest of the state. So we have strong vaccine advocates and parents who've had their kids on the list since before the vaccine was available, and who are thrilled when their child turns 12, and who are hoping and praying that we will get an EUA for 5 to 11 at any moment, and we'll be the first ones in our door to vaccinate when that happens. We have people at the other end of the spectrum who are strongly convinced that the government is experimenting on their children and that this is an unsafe vaccine. And I am old enough to remember the days when it was considered better for your child to get chickenpox than to get the chickenpox vaccine. And this feels a lot like that some days. And this is a lot scarier than chickenpox was as a professional thing that we're tackling. And then we have a lot of people in the middle who just don't know what to believe and what to think and how to encourage their kids, and don't like giving their kids shots at any point, let alone another shot. And they don't know how many shots they're going to have to get, and are they going to have to get a booster? And they don't want to deal with their teen or preteen kiddo who doesn't like shots. So it is all over the place. And I think that you hear a lot from the people that frustrate you the most. You rejoice with the people who show up for a vaccine and celebrate those small victories. And you spend a lot of time in your community and in your exam room talking to people about how important this is and how different this is than anything that you've ever done in your career as a healthcare provider, and how you've vaccinated your own children and that you believe in the safety and efficacy of this vaccine. And I think sometimes my words as a mom mean more than my words as a doctor. But it is an every day that I see patients, I have more than one conversation about vaccines with them. And it ranges everywhere from, I can't believe my grandchild, my daughter, my son won't get the vaccine, to I can't believe that anyone would get the vaccine. Every conversation ranges the gamut. And it gets, professionally, it gets fatiguing. It's very tiring. And my message has changed over time. Currently, my message says, shut out the noise, decide who you trust and listen to them. And if you don't trust me, then maybe I shouldn't be your doctor. And since I've been these folks' doctors for probably 20 years, that message usually resonates. And I tell them that I believe it's safe and effective and the right choice to make for themselves and their community. And sometimes I get through that day. Sometimes I get through weeks later, and sometimes I never get through. But I suspect that that's the same everywhere in Kansas, everywhere in the United States. And where you find groups of people that have more of the folks excited about the vaccine and vocally demonstrating their excitement and their participation, then you tend to get more of that crowd in the middle that feels comfortable moving that direction. And I think in rural areas, you have a lot fewer of those excited vocal people. They quietly get their kids vaccinated, as opposed to posting it on social media, talking about it in church, those kinds of things. So I think that's a lot of times the battle that we fight is a political battle more than a medical one.
I appreciate your sharing that, Jen. And we have all seen the same data, national data, that tells us that people are most comfortable hearing about vaccinations from their doctors. That is national data that we are now seeing validated in Kansas. And we're able to look at those who not only are vaccinated, but who are not vaccinated. They still want to hear from their doctor more so than anyone else. And so I recognize how exhausted you all must be and how time consuming this is, but the importance of healthcare providers taking the time to answer those questions and assuage people's fears and be patient. Every poll I've seen, every bit of research says that. So thank you.
Marcy, I've got a question. What does the data say about socioeconomic status for people that are in these counties that have these rates? Are the two associated at all with either amount of money, amount of education or experiences, et cetera? How does that relate to who's going to get the vaccine and who doesn't in the state of Kansas?
Yeah, we will in the coming weeks be able to share some really detailed information because we've been asking just those kinds of questions, Dr. Mills. The preliminary look at the data suggests that there are some differences by race, class, ethnicity, gender, um, urban, rural, conservative, liberal. The Kansas data doesn't look much different than the national data. So we know that folks in some of those rural areas tend to be lower income, and there's certainly a correlation back to the point that Jen made about trust. In communities where there isn't a lot of trust in the government or even trust in science, that's where we see some of the greatest vaccine hesitation. And that's not always, of course, related to demographic characteristics. It's more related to where you live and who's in your social circles. But what we do know, we do know some important things that are working in Kansas that are encouraging when we look at this data. One is that the cost of the vaccine or perceived cost of the vaccine isn't a barrier. So that message is getting through that the vaccine is free, and it's also pretty readily available. And so the reason why it's so important to do these detailed dives into the data is to figure out which problems you're trying to solve for, because we've figured out how to get vaccine out to people. We've got the message out that it's free. But now the folks who are vaccine hesitant have a lot of questions back to Dr. Brule about side effects and your comment about it's safe and it's effective. I think that we just need to continue to repeat that, share that data. The number one concern that folks have about the vaccine, Dr. Mills, is side effects.
Right. One of the questions I often asked at meetings was, who stands to benefit from the person being vaccinated or not being vaccinated? Where's the beef in this? Who is the person that's going to benefit from this when you don't vaccinate? And where that information started and came from. Because a lot of times, I don't think people understand why they believe what they think they believe. And so my question with that is that maybe to look at some of those root causes of where these things came from, and some of the history, especially out to the general public, to understand that vaccine hesitancy isn't something that's just new, that just started with COVID, that it's been around for a long time, and that there's some things that are just set up that that some people use to have really kind of control over your ability to do certain things. And who's going to benefit from you being sick, or you being well, or you being educated, or you're not being educated? Because I think sometimes they can understand that versus I need a shot or don't need a shot, for their own self-interest, if nothing else.
Yeah.
So.
Yeah, that is definitely a great perspective for sure. Thank you, Dr. Mills, and thank you, Marcy. I guess on that same topic, someone from the education side of things, thoughts on that in how we can partner, or how our schools can also help to increase access to administration of the vaccines and information to them and their parents, or increasing vaccines with our teachers and staff as well. Any thoughts there?
Hi, this is Kimber again from Wichita. And I do think that it's important that our schools do what we did last year to get staff vaccinated for COVID, as we partnered with Our local health departments also, many districts have partnered with pharmacies and other clinics in their area. I know that some of the doctors from KCWK went out and helped several clinics around Sedgwick County and other areas as well to help get staff vaccinated. I think this is a community team process, whatever we need to do to get this done. Also, school districts can apply through KDHE to be a COVID vaccine site, is which what we did last year and vaccinated nearly 5,000 staff members for COVID. And we do plan on, once Moderna is passed for that booster dose, to be able to do that as well. And we've been working with our health department. So I think the key is to have this when it's accessible for parents at different activities, weekends, evenings, making it available to parents when they can get there for the vaccines, and being able to get the information from like IKC, Immunize Kansas Coalition, so that we're putting out factual, evidence-based information to share with these parents and also our community members so that they understand the true benefits of the vaccine.
Thank you, Kimber. All right. I see videos of Mr. Bowie. There you go.
I think Kimber's exactly right in getting that word out there. But I think the other piece that may be critical is getting a better understanding of why kids are not getting the shots. I think we speculate quite a bit of maybe it's a parent or maybe it's something else that's going on. But what are those fears that the kids are going through? And if there's a way that we could maybe gather some information, a random type of survey from kids, and see if we can help eliminate some of those fears or concerns down the road. I just think there's a lot of information out there that sometimes doesn't always trickle down to kids. And if there's a way we can help get kids the information, may be beneficial as well, along with what Kimber talked about.
I love that idea. Thank you.
In addition to that, I am seeing a lot of parents say, my child had COVID. They were very mild in symptoms. They were fine. And so I really think not scare tactics, but I think sharing that the landscape of COVID this year looks very different for children than it did last year due to the Delta variant. And we are seeing children in hospitals, and we are seeing children with some long-term effects from COVID. And I think that we need to share that information with people so that they understand that you're right. Some people have very mild symptoms with COVID, but others may not. And it doesn't always correlate to comorbidities for people. So I think we've got to come at it from a lot of different angles. Yeah.
Dr. Watson?
Dr. McKinney, I don't disagree. Certainly Kimber and GA have given good advice. I would just, and I would encourage us to look at the data on the 12 to 17-year-olds and just acknowledge that we haven't done a good enough job resonating with that age group. My worry is the efforts that we're doing there, if we replicate that in some way, we may see even a less response in the younger kids. I don't know, maybe an equal response, which is going to be hovering around 50%. So if we're not getting the desired results in the 12 to 17, despite terrific efforts, right, on everyone's part, I was listening to Dr. Burrell talk about just, the fatigue of what she's doing just in conversations. Maybe the group really has to think about what would we do very different when it's time to really turn up the vaccination rate for the younger kids. Or I'm afraid we're going to set 4 weeks, 5 weeks, 6 weeks, 9 weeks after that and say we're at 25, 30% and we're growing by 1% every 3 weeks. That's just by looking at the 12 to 17-year-olds. And so I don't have the solution. It's easy to come up with the problems, right? And I wish I could offer up, maybe we could think about this or this, But I think collectively, if we think about what do we think worked with 12 to 17-year-olds, double down on that, and then think completely different about really what communication strategies just simply did not work. And Marcia, you probably have analyzed some of that. So,
well, we have, and it does get back to where people like to get healthcare services, and back to physician offices, people that they know. So, for example, we don't love mass vaccination sites in Kansas. That's not our thing. But we know that that's an efficient way in which to get vaccines to many people. You don't want to have a lot of mass vac sites and not have them used. But this does get to a question that I had, Randy. One of the things that we know is if vaccines are just readily available, just they're at the pharmacy, they're at your doctor's office, they're at the hospital. And I have heard that there are some large hospital systems that are saying, that's not our role. Despite how incredibly important hospitals were in the initial rollout of the vaccine. So I'm just wondering if folks have heard this, if as providers, folks are encouraging their hospitals to keep vaccine because you've got kids coming into the ED. So it's a rumor on the street that I'm trying to verify.
One of the things we've done in our community is make things available in all settings. So we're small. So I help staff the emergency department too with the rest of the family docs in our community. And we were able to partner with the ER to set up protocols for both vaccination for inpatients, for ED, and and then monoclonal antibody therapy in the emergency room for appropriate cases, which helped reduce our burden of rooms that we needed to keep isolated and staff that we needed to, gown up and everything else. And that's been helpful to increase access to services quickly. Is any door they come in, they can get it.
That's awesome, Jen. Thank you. I think we all strive to kind of meet our students and our patients where they are, and that's a perfect example of it. So great example. All right, we're in our last 8 minutes. I just want to make sure we're keeping track of the time. Some comments in the chat. Most of the questions we are receiving are related to the booster and when they'll have access. And school employees, especially teachers, love the convenience of vaccinations available at the schools. And then also finding early adopters as well. So fantastic. Great discussion on vaccinations in the schools. Sorry, go ahead.
Jen, I was going to ask if Dr. Duvey might talk a little bit about monoclonal antibodies. Kansas is actually making quite good use of monoclonal antibodies and has been for some time, trying to make it readily available across the state. Lots of folks don't know about that as a treatment. If we can catch someone early in their course of illness. And I did not warn Joan that I would be asking that question.
Yeah, thanks, Marcy. I think monoclonal antibodies are a great option for someone who either isn't vaccinated and tests positive for COVID and becomes symptomatic or is at high risk. Or somebody who is vaccinated but has additional risk factors like they're immunocompromised, being treated for cancer, and tests positive for COVID, has a breakthrough case. Monoclonal antibodies, it's really important to understand that they're an outpatient treatment. If your symptoms are so severe that you need to be hospitalized, it's too late. So we want to catch you early. And that most the way that they're predominantly being administered in the state of Kansas is through IV infusion. So sometimes it can be difficult to locate a site where you can get monoclonal antibodies. But there is, if you search online for monoclonal antibodies in the state of Kansas, you'll find maps of infusion centers, and you can go there and hopefully get access to monoclonal antibodies. One of the things that everybody should know is that the federal government distributes these. They were distributing them directly to sites, to administration sites, but there is a scarcity of this as a resource now. And so the allocations to states have been decreased. And so now those antibodies are being sent directly. Well, they're still being sent directly to sites, but the ordering has to come through the state. So we are seeing decreases. We'll continue to see some decreased inventory. But it is really a pretty effective intervention at keeping people out of the hospital and from progressing to severe COVID. So I don't know, Marcy, if that is what you were interested in.
That was exactly what I was interested in, sort of a 101 on monoclonal antibodies. Thank you, Jen.
You're welcome.
And I think, sorry, I apologize if I did miss this, but that the monoclonal antibodies are should be free. Is that correct to patients?
That's right. That's right. So the drugs themselves, well, they are free to patients. If a patient has insurance, the infusion site can charge an administration fee, but the drug itself is at no cost. And the administration fee, if you have insurance, should be reimbursed through your insurance company, and you should not be balance billed for that.
Wonderful. Thank you.
You're welcome.
I did want to catch in the chat, there also were comments about that teachers and educators are approved for boosters, but they do have to be the Pfizer vaccine at this time anyways. But hopefully others will be authorized in the future. And then just picking up, because I never want to miss a chat comment, on my comment earlier about masking and testing causing stress for students. There is a comment that I agree with you that that the impact they have on the ability to be in school safely outweigh the other challenges. But I wanted to mention some of the things the K-12 testing teams hear. Masks and testing can be stressful on the students without the proper messaging and support to the students. In our group, we have been helping to create tools and messaging for the schools to help navigate anxiety with testing, and especially for positive results, so the students feel supported during that situation. We also work on issues with isolation or being singled out as masking or testing. I think this has been improving that anxiety in schools regarding masking and testing. So thank you. And that is such a great message. Of course, with all that we're doing, the messaging, this is everything, right? Messaging is everything when we're doing anything, whether it's vaccines, testing, masking. So thank you so much. Great comment. All right. Oh, go ahead. Yes, sorry.
Got one more comment, and I'm going to try to make this real concise. If I had that group between 12 and 17 years old, and you asked me about whether or not how we could get in touch and work with them, the answer is that 12 to 17-year-olds are kind of technically insane. It's not the group of people that I would exactly expect to make the best decision. So I usually don't listen to what they have to say, other than listen to what they have to say. And to be perfectly honest, I would drop it in on the parents, like I normally do, is that it's their responsibility to keep their kids safe. And this is a matter of safety. And so it's real concise. There's no theory behind this, but to me, that's kind of where I would be on that.
Dr. Mills, I always appreciate your opinion, and you don't mess around. Tell it like it is. So love it.
And every parent on here is saying, oh yes, Dr. Mills is so right about that.
Awesome. with our last minute or two, any other comments on the dashboard, please let us know, because we do want, whether that's now or like through email or whatever, because we do want the dashboard to be something that is helpful for people. What information is missing? What have you heard out there? What do people like? What do people not like? Those kind of things are going to be really important, because we do want to be very transparent and get that information out there to people.
We should have had, Jen, and we'll bring this next time, data on hospitalization, especially pediatric cases, because we had been seeing pediatric cases rising, and they are starting to fall, and that is very good news. Adult rates were falling first, but there, you can't just claim 2 weeks as a trend, but it does appear to be getting better. We'll bring that next time.
Thanks.
Great.
Okay. Oh, go
Hey,
ahead.
Jen, just we may plug one more time the member highlight section so that people can bring topics to that they would like to talk about and discuss.
Yes, please. Anytime before our next meeting. Of course, we'll be meeting next Wednesday as well. Anytime before then, if something comes up, just shoot an email to us and just say to us or Marcy or Dominique, and just say, hey, this is what I heard this week. Can we talk about this? That we would love it, because again, you guys are right there with the students, with the teachers. We want to know what's going on. All right, Stephanie, do you want to bring it home?
No, yeah, just thank you guys again for all your time and effort, and we really appreciate you guys being here and keeping our students safe, and certainly first and foremost, and then also keeping them in school where education is so important. So thank you again for all you guys are doing.
All right, thank you very much, and we'll see you next week.
All right.